Right. So I think a lot of the things that we want to see moving forward have already been mentioned, and I won't repeat all of those. We need strong coordination mechanisms across governments with industry. We need national capacity, the planning capacity. We need national decision-making capacity. We need a trained workforce, both healthcare workforce and biomedical engineers. We need sustainable financing, both domestically and and internationally. So I won't repeat all these things that have already been mentioned. I think we have a pretty clear idea in terms of what needs to be done. And now, to put it simply, we just need to work together to do that. For example, we at Unitaid, we keep identifying new investment opportunities, for example, for innovative technologies or business models for oxygen delivery systems. Just today, for example, we published a new landscape report that provides an overview of exactly those systems and business models. So our future investment decisions will be based on the findings of that report, and we will continue to shape the market and to introduce better, more affordable, sustainable, cost-effective solutions for oxygen delivery systems. But I think beyond that perspective of an individual organization, what is evident, we really need to make use of the knowledge that is out there about the gaps, the strategies to close those gaps, the partnerships that exist. And here, as Leith already alluded to, I really want to call out the Global Oxygen Alliance, which is the successor to the Oxygen Emergency Task Force. So when the pandemic was declared over and the ACTA partnership was winding down, the Oxygen Emergency Task Force transitioned into this, let's call it, more stable, but also broader, more inclusive partnership called the Global Oxygen Alliance, that now includes more than 20 global health partners, but also representatives from affected communities and from civil society. Every Breath Counts Coalition, of course, is part of the alliance, and Unitaid continues to take a leading role in that as a co-chair together with the Global Fund, and as well as a co-host, the Secretariat of the Alliance, together with WHO and UNICEF. So the Alliance really calls on governments, on the one hand, to prioritize access to medical oxygen in their strategies, in their policies, in their financing, in order to transform those investments that have been made since the early days of the pandemic into actual lives saved in the long term in a more sustainable way. So to continue with investment in to increase oxygen production capacity, to lower the prices, and to provide support to governments, technical support to build those national plans and roadmaps that we've already heard about today. But what is critical for all of us is that this is not limited to the usual donors and global health agencies working with governments, but we need to make the link to industry. We need to ensure that the conversation between industry and global health partners and governments happens, that we are aware of each other's needs and offers, and we can help to shape that market together in order to increase availability, to lower the prices, and to make sure that there is a sustainable and equitable supply and access to medical oxygen. So this is an effort that no sector and that no organization can manage to achieve, to realize alone. So we need to come together here and make use of this partnership to succeed and to close that gap.